everyone. I'm your host, Aaron Fine, and I'm the social media marketing coordinator for MS Focus. Before we start the webinar, I'd like to introduce this year's National MS Education and Awareness Month booklet slash toolkit. The theme for 2024 is MS Warriors Battling Autoimmunity. We wrote this toolkit with the aim to provide a deeper awareness of the immune system, benefits of and advances in treatment, and how you can advocate for autoimmune research in your community. If you're currently subscribed to our MS Focus magazine, then please be on the lookout to receive your 2024 toolkit in the next few weeks. If not, please respond to your registration email of this webinar and we can add you to our mailing list. To make this toolkit and today's webinar possible, I would like to thank our wonderful sponsors, Genentech, Sandoz, Viatris, EMD Serono, and Sanofi. Thank you everyone for your time, and we hope you enjoy this webinar. Now, I'm thrilled to introduce our speaker. Dr. Kalina Sanders is a board-certified neurologist with Baptist Neurology in Jacksonville Beach, Florida. She received her Doctor of Medicine degree from the University of Texas, HSC San Antonio. She completed her internal medicine internship and neurology residency at the University of Florida, Jacksonville. She subsequently completed a Master of Health Administration at the University of North Florida. She is currently the director of the Comprehensive Multiple Sclerosis Center at Baptist Health, and she serves on a number of executive committees for her practice and the hospital. She is also the chair of the Florida Healthcare Provider Council with the National MS Society. She has a passion for clinical care, medical research, and patient education. Dr. Sanders, we're so pleased to have you join us today, and thank you for taking time out of your busy schedule to educate us all. So I'm going to turn it over to you. Thank you so much.
Awesome. Thank you for that wonderful introduction. How did you know all of that about me?
It was all Wikipedia.
It was on Wikipedia. Awesome. All right. I'm going to bear with me 1 second while I share my screen here so we can get started tonight. All right. Hopefully everyone can see that nice and clearly. Good evening, everyone. It is a privilege to be online with all of you tonight. Thank you for sharing your afternoons and your evening with me. I am always excited to be able to share information about multiple sclerosis, especially during National MS Awareness Month. So tonight, I am going to be discussing complementing the immune system and particularly how our lifestyle choices play a role. I would like to add lots and many thanks to Megan Weigel, who I have the pleasure of working with and learning from on a daily basis. She provided most of this presentation, and I hope I can do it justice. Let's go here. So this is what we are going to be talking about today. Our objectives are, I'm going to provide an overview of the immune system and how it impacts multiple sclerosis, briefly describe how our disease-modifying therapies affect the immune system, but would really like to spend a lot of time discussing lifestyle changes that complement our immune system, particularly nutrition, movement, mindfulness, and overall MS care. And then I will touch briefly on some common supplements and vitamins that I hear about in my practice and supplement safety. So what is our immune system? Let's jump in and talk about it. The purpose of our immune system is really to provide a defense to fight bacteria and viruses and keeps our bodies safe and healthy. Our immune system is really made up of many types of cells, as you can see here on the slide. And our immune system is made up of really two distinct parts. One part is called the innate immune system. And as you can see on the slide, it has things like macrophages, neutrophils, natural killer cells, and then we have our adaptive immune system, which is made up of our T cells and B cells that we kind of commonly think about in multiple sclerosis. I like to think of our innate immune system as our first responders. So if you think about your paramedics or your fire rescue people, they go and they attend to any emergency that there is. They don't care what it is, who it is, or whether or not they know what's wrong with them. They go and attack anything. Our adaptive immune system, I kind of like to describe as our hospital. This is housed with our doctors and our nurses who have gone through special education and have specific knowledge in what care that they provide. So they are very particular about what they see and what they treat. And so when we think about kind of our rapid response and our slow response, we have to think about them differently. And so as I move through the slides, I want you to kind of remember what these different cells do. And we will, though, spend a lot of time talking about the adaptive immune system, which is really made up of our T cells and our B cells. So, what happens in multiple sclerosis? This happens. There is a lot of things going on in this picture that you can see. But really, what happens is that our adaptive immune system, which was supposed to learn that it should fight a bacteria or virus, kind of fails itself and it starts to see your central nervous system, which is made up of your brain and spinal cord and optic nerve. They see it as foreign and they attack it. And this is what we call an autoimmune response. So your immune system cells, which are meant to fight external things, are now fighting internal things. And as I mentioned before, these cells are your adaptive immune system, the slow responders, the doctors and nurses in the emergency room. And they are made up, again, of our T cells and B cells. But we also know that there are other players in the game. They are supposed to be outside of the central nervous system in our lymphatic system and our blood cells, but they do get across into the central nervous system where they wreak their havoc. So let's break it down a little bit further with our immune system. So I talked about our T cells. Not all T cells are bad. There are really three main types of T cells, and these are our Th or our T helper cells. There's a Th1. These are primarily our inflammatory cells. These are the ones that are confused and going into the central nervous system and creating destruction or demyelination. We also have our Th17 cells, which are also inflammatory and also considered our misguided or our bad T cells. But we do have Th2 cells, and these are our truly helper cells. They are our anti-inflammatory cells. They are there to help to protect our nervous system. Now, when we talk about B cells, as you may know, create antibodies. And it is partly the antibodies that are going in and attacking the demyelin or the myelin in the covering around our nerve cells. B cells are oftentimes, though, activated by our T helper cells. So they not only work independently, but they work together to wreak the havoc that we see in multiple sclerosis. So all of them are important, but I do want to focus on our T cells and our B cells. Now, I mentioned that there are other players involved in the MS process. I think one of the main things are our dendritic cells, which are help to present the wrong information to our T cells and our B cells. Our macrophages are kind of like our garbage man. They are there to go and help clean up um, bad areas. And then we have our microglia, which are our immune cells that actually reside or live inside of our central nervous system. Now, in MS, they are also doing the wrong thing. So oftentimes they will clean up things when it's not needed, or they go and they precipitate or make the inflammatory process worse. And so all of these, though, are part of the immune system when it comes to multiple sclerosis. So how do our disease modifying therapies affect the immune system? As you can see here in the chart, and as you're aware, we have almost 20 different disease modifying therapies. Some of them are in the same class and they have the same mechanism of actions, but you can see here that they exert their primary effect on either our T cells or our B cells. If you are still on an interferon therapy, that might be Rebif, Betaseron, Avonex. These actually decrease T cell activation and they don't allow them to grow or proliferate. And they also prevent the T cells from crossing into the blood-brain barrier. So they work peripherally, but also prevents them from going in. Glutarimer acetate is an interesting one in which it actually causes a shift from our pro-inflammatory T cells. If you remember, it was our Th1, our Th17, and it actually tricks the body to create more helper or anti-inflammatory cells, Th2 cells. And so it doesn't necessarily decreases T cells, but it causes them to shift from a pro-inflammatory T cell to an anti-inflammatory T cells. If any of you are on our S1P modulators, that's like Gilenya, Zeposia, Mazen. Those work by sequestering or keeping your T cells and your B cells inside of your lymph nodes. When they are sequestered inside of your lymph nodes, they are not circulating in the blood. If they're not circulating in the blood, they can't cross the blood-brain barrier, and that reduces the amount of inflammatory attacks to the central nervous system. Our fumarates also kind of help with that Th1 to Th2 shift, but they also serve and by activating an antioxidative pathway. So we know that oxidative stress can cause our cells to die and cause a dysfunction within our central nervous system. And so the fumarates like Tecfidera or Vumerity, they help to quiet down that oxidative stress that occurs within our central nervous system. Teriflutamide is another one, and it works by preventing our T cells from dividing and proliferating. So they're not, our T cells and our B cells, so they're not, again, attacking the nervous system. And then many of you may know about our B cell depleters. That's our Ocrevus and Briumvi, Kesimpta. They work primarily on our B cells. So they prevent our B cells, or they cause a decrease in the number of B cells that we have in our bodies. And so the B cells aren't talking to the T cells, and they're not creating antibodies to attack our nervous system. Tysabri or natalizumab, it works by preventing your T cells from crossing the blood-brain barrier. So that's another way in which it's not necessarily taking away cells, but preventing their migration. If any of you have heard of Mavenclad or cladribine, it also works by decreasing our T cells and our B cells. And then they are allowed to repopulate, and then they are depleted again. And again, when the when the T cells and the B cells come back, it's felt that they are smarter than they were before. On this slide are BTK inhibitors. Those are currently still in clinical trials. They are looking at BTK inhibitors for people that have both relapsing MS, but they also looking at it in secondary progressive and primary progressive MS. But I think it's a good opportunity to talk about the impact of microglia. So many of you may have heard some recent buzzwords of smoldering MS or slowly expanding lesions. And part of the process of smoldering MS is the activation of microglia. And so BTK inhibitors are felt to decrease B cell numbers, as well as decrease the activation of microglia within the central nervous system. And so there's some optimism. The clinical trials are still ongoing, and so we don't have full data or much data yet, but there may be some impact of BTK on the process of smoldering MS. So as you can tell, all of our disease-modifying therapies work on the immune system. They're there to prevent relapses, to prevent MRI changes, and to hopefully prevent or have some impact on disability progression. But as you noticed in the title, we're talking about complementing the immune system. And so when we think about complementary medicine, a lot of people start to think about alternative medicine or integrative medicine or functional medicine and kind of use those words interchangeably. And so this slide really just highlights the difference between what we consider as conventional medicine, which is disease focused. It's treating the symptoms. It's using our disease modifying therapies, as I just went through on the previous slide. And it's kind of based on Western medicine. But then we have alternative medicine, which is kind of uses a combination of our conventional medicine as well as some of our complementary medicine. The complementary medicine approach is kind of more of a modern approach. And again, it also uses both conventional and alternative medicines. And then integrative kind of puts it all together. And really, though, focuses on data-driven solutions. So they really focus on what the evidence supports. And then there is functional medicine as well, which kind of maybe tries to figure out how to treat the patient holistically and not just the disease. All right. So lifestyle changes and the immune system. It's no longer a myth that physical and psychological stress causes low-grade inflammation in the body. And this low-grade inflammation can result from various disease states. So if you have comorbid hypertension or high blood pressure or high cholesterol or chronic stress, it can create low-grade inflammation. And that low-grade inflammation can result in other disease states, such as autoimmune diseases like multiple sclerosis or cancers. Now, this low-grade inflammation can be modified by things like nutrition, mindfulness, and movement. So we all know the rhyme Humpty Dumpty, right? In the rhyme, Humpty Dumpty is on a wall and he has a great fall. It doesn't tell us, though, how he fell off the wall. I have read many theories on the internet about how Humpty Dumpty fell off the wall. Either he slipped and fell. There's some reports that it's in reference to a war and a cannon hit the wall and Humpty fell off the wall. But ultimately, in my mind, he fell off due to bad choices. Whether it was the choice to get up there to begin with, because maybe it didn't fit his body, or maybe he chose to bend over to reach for something, and that led to his fall. So when it comes to our health, let's see here. When it comes to our health, there are really things that are come into play. There are our genes, which we really have very little control over. It's our environment. And then there are some things that are interactive or part of our biochemistry. And the way these things kind of line up together or integrate either result in wellness or illness. Now, like Humpty Dumpty, who had a choice to either get on the wall or not, we also have choices based on our environment, where we are, what we choose to maximize or minimize. And then we have choices regarding our biochemistry, and that is primarily with our nutrients, our detoxifications, our energy levels, that really determines whether or not we will end up with wellness or illness because of it. So let's talk about some of those choices. We'll start kind of with nutrition, which I think is very important. And ultimately, as I go through the slides, I want you to keep this quote in mind when it comes to nutrition. Eat food, not too much, mostly plants. Oops, wrong button. There we go. So when we think about our foods, there are the good and the bad. So some of our foods are really there to help to stimulate anti-inflammatory effects. So there are receptors from foods that are high in fiber and omega-3 that help to reduce the amount of inflammation. Some of our flavonoids activate also anti-inflammatory effects. Some of our short chain fatty acids that are made in the gut from high fiber foods produce anti-inflammatory cytokines. Sorry about that. And then foods that are high in polyunsaturated fats and oils are also anti-inflammatory. And this is kind of really in animal models have been shown to maybe have some neuroprotective effects. And then higher levels of intake of fruits and vegetables, that's going to be key, are also associated with reducing relapses and disability. And then foods that are high in fiber from whole grains, and again, our fruits and vegetables, decrease the recruitment of inflammatory cells and proteins. So there are definitely foods that can have a good benefit for us. Now, how about the bad? So saturated fats and oils, our butters and our creams, increase pro-inflammatory and increase some of our interleukins, which are also molecules that create inflammation. Our long chain fatty acids, things that are found in processed foods, foods that are high in omega-6, actually stimulate our inflammatory T cells. So if you remember from the beginning of the presentation, our Th1 and our Th17 cells, those pro-inflammatory cells, are actually activated by our processed foods. And then our saturated fats and oils, again, those that are high in omega-6 and sugars, also increase our risk for vascular disease. And so we know that the vascular changes that occur in our brain also impact how our nerve cells function and impacts how our MS progresses and changes over time. And so those patients that have comorbid high blood pressure, high cholesterol, diabetes, those are primarily the vascular comorbidities, actually have a progression in their EDSS or their disability status sooner than those who don't. So what we eat definitely has an impact, not just on our immune system as well, but our brain health. So there are a number of diets that are available. There is really no best diet. But if you're like me and you struggle with making choices and like to follow a plan, there are a number of different diets that are available. Many of you may be aware of the Walls Elimination Diet, and this is kind of based off of a paleo type of diet. And so they are really somewhat restrictive or confined to meats, fish, nuts, vegetables, and fruits. The paleo diet limits dairy and grains and definitely limits processed foods. The swank diet is out there as well. The swank diet is kind of one of the oldest diets, and it was created by a physician back in the 1940s and 1950s, where he really limited the amount of red meats, oily fishes, and limited the amount of saturated fats and unsaturated fats for the patients. And then he followed them, or he followed up with them 15 years later, and he found that in patients who adhere to his diet, they generally were doing better than those who partly adhere to his diet or did not adhere to his diet. There are others overcoming MS, and they're all the McDougall diet, the Mediterranean diet. Many of us are doing ketogenic diets, and then there are like the fasting mimicking diets. And really all of the diets really have very similar recommendations, particularly with cutting out dairy, certain meats, eating less fats, and then supplementing with things like omega-3 and vitamin D supplementation. The McDougall diet is a low-fat vegan diet. So if that's something that you're more interested in, you may consider looking into that as well. And then the Mediterranean. And really the goal of all of them is to decrease the inflammatory impact of our immune system. So let's switch gears to exercise. Many of us hate to get up and go and do it, but glad we did once we're done. Movement is definitely key. And exercise for an individual person is different from others. And so, what I might consider as a hard workout, you might think it was pretty easy. But exercise is important to know that it is associated with the production of brain neurotrophic factors, which are felt to be neuroprotective, particularly during the inflammatory response. The other thing that exercise can do is it can decrease our risk or improve vascular disease. So it's not just helpful for the immune system, but again, the high blood pressure, the diabetes, the high cholesterol. And then for some, it actually helps to improve our mood. It helps to upregulate some of our serotonin receptors and give us a little bit of a lift in our energy. When it comes to movement, you choose moderate exercise or movement. The goal is to aim for 150 minutes per week of movement. And again, that may not all be exercise. That may be just taking a walk around your kitchen island. You don't have to do it all in one big trunk. Consider small chunks, maybe sitting or splitting it up to like 22 minutes a day. Even if it's 5 or 10 minutes, any type of movement is good. And then you choose really the best time of day for that. You want to make sure that your fatigue level allows you to participate in the activities. You want to make sure that you're staying cool and really choosing something you like to do. And if you're like me, you need an accountability partner, enlist some help, get someone else to work out with you. That keeps you motivated and keeps you moving. Now, let's switch gears to mindfulness. When we think about the impact of stress and really the role it plays, when we look back over time and the evolution of the humans, stress and our fight or flight response was beneficial. It saved our lives. It kept us from being captured by animals who were trying to eat us. But over time, we have kind of evolved into really a constant state of stress. And that may be our electronic devices, that may be the amount of coffee that we are taking, the amount of money we're spending, the traffic we're sitting in on a daily basis, and maybe the lack of exercise that kind of gives our body kind of this fight or flight feeling all of the time. And that generally is detrimental or harmful for us. So when we look at kind of how our body responds to stress, and there are really a lot of things that come into play within our nervous system. So if we are kind of mellow and calm, and we are socially engaged, we are mentally engaged in things that we enjoy, our digestion increases, we are resistant to infections, have the ability to relate and connect to other people, and our bodies are really in a kind of a steady state. But as we kind of start to increase our stress, we kind of get into that fight or flight. Our blood pressure starts to increase. Our heart rate goes up. Our adrenaline hormones get going. That might result in worsening of our MS symptoms when those adrenaline hormones get going. And so when we get beyond that into the freeze standpoint, that's like you in front of that tiger and it's about to eat you. You can't move, right? And so when we are in that freeze part of our bodies and our stress, we become depressed, we become feeling of helplessness, we shut down, we dissociate, or we don't engage, and our bodies struggle because of that. And so really, I think our goal is to remain in the green zone, so in that social engagement, with using our flight or flight as life gives us, because we all know that life isn't always peaches and cream and cherries. And so we want to, though, do our best to kind of stay in the yellow to mostly green phases. So how do we do that? If my screen works, there we go. Mindfulness. So meditation improves our immune response without increasing in inflammation. So we get a boost of our immune system, but it does not cause our MS to get worse. It stimulates activities in areas of the brain that help to control our emotions, particularly our frontal lobe. So it kind of gives us more of our serotonin that's available in our brains, which is our kind of our feel-good hormone. And so mindfulness decreases that fight or flight, that yellow zone. It definitely helps to ward off the freeze, the red zone, and it decreases our inflammatory factors that I've mentioned before, and increases our anti-inflammatory factors as well. So mindfulness is, again, like exercise, very different from person to person. That meditation may be spiritually based, or it just may be mindful based, where you are centering your thoughts, or you are praying. And so whatever is befitting for you is what you should focus on doing. And that mindfulness, like our exercise, should occur every day. All right. So let's switch gears in our final few minutes of the didactic part of it, because I do want to make sure that we have enough time for questions. I will touch briefly on the role of supplements in our for our immune system. And so when it comes to overall symptoms of multiple sclerosis, there are a number of supplements that have been evaluated to some point. Many of them on this list help to support the nervous system and not specifically the immune system. But I would like to highlight in the next few slides some that are kind of specific to complementing the immune system, so helping with that. And that's going to be primarily vitamin D, vitamin A, and other antioxidants. And I will touch on biotin as well. So probably our most studied vitamin and the impact on the immune system is vitamin D. Vitamin D definitely has immunomodulatory properties. There are actual vitamin D receptors on our immune cells, so our T cells and our B cells. And really the presence of vitamin D helps to reduce the expression of some of those inflammatory chemicals and hormones that are released. It helps to support our macrophage maturation. So remember, our macrophages are the cleanup people. So we want to make sure that they are cleaning up appropriately and not doing it at inappropriate times. It enhances our innate immune system. So it helps our first responders to be more effective and maybe help to take care of our bodies, and where our adaptive immune system doesn't have to take the full load. And it does help to regulate the production of those pro-inflammatory cytokines. And so vitamin D is extremely important for our immune health. When it comes to vitamin D supplementation, you really should talk with your healthcare provider. The recommended daily allowance is around 600 to 800 international units for adults, and that's the general population. But when you talk with your healthcare provider, knowing what your levels are and having the appropriate dose can be the decision for the correct dose for you. Vitamin D3 is preferred rather than D2 because vitamin D3 is what our bodies naturally make. And so we want to simulate what our bodies are normally doing. I think it's extremely important to note that doses greater than 4,000 international units daily may cause toxic effects. So you can definitely have too much vitamin D. And so you want to make sure that you're monitoring your levels as you are doing your supplements. And what about antioxidants? So antioxidants tend to decrease the damage caused by free radicals and oxidants in our bodies. Main antioxidants include vitamin A, but vitamin C and E are also considered antioxidants. And they are helped by our vitamin B6 and B12, and they're also very important. But I would like to talk specifically about vitamin A because there is some small amount of data that shows its potential benefit in reducing the inflammatory process. So again, it helps by modulating and regulating the Th1 to Th2 shift that we talked about previously. And it also helps to modulate your B cells and some of your dendritic cells. And so the increasing in autoimmunity and regeneration tolerance in the central nervous system is reduced when someone is taking vitamin A and the other antioxidants. There was a clinical study that supported the evidence of using vitamin A in clinical symptoms. It improved the total multiple sclerosis functional composite score in patients who had relapsing remitting MS. But unfortunately, in the study, it did not show any impact on disability progression, relapse rates, and patients still had new brain active lesions on their MRI. And so it's really important to note that there is no well-documented published studies in people that show a true clinical benefit of using them. And so there should be some caution because sometimes the antioxidants can stimulate the immune system. Now, how can we get the antioxidant effect without using the vitamins? If anyone was paying attention before, you know that fruits and vegetables are extremely helpful, and they can provide us with the antioxidant effect without using the supplements. And so eating 2 to 4 servings a day of fruit, 3 to 4 servings a day of vegetables can help us get and accomplish that goal. All right. How about biotin? Many people have been using biotin, and there was a study published in 2015 that was a pilot study looking at high doses of biotin over the course of, I think, a 3-year period in primary and secondary progressive MS. In those patients in that cohort that use high doses of biotin, which was about 100 to 300 milligrams, had a positive effect on their disability progression and their timed 25-foot walk. But other studies have been mixed that did not show a potential any benefit for relapsing disease. And so biotin, I think it's important to highlight that it can interfere with other laboratory results. And so we have to be cautious, particularly if we are looking for things like thyroid issues, cardiac enzymes, and some cancer markers. Testing can be erroneous or off because of the use of high dose biotin. So you definitely want to talk with your healthcare provider about those risks and benefits. I think it's interesting to note that Americans spent a lot of money, $227 billion on nutraceuticals in 2020. And so there are some benefits for some of them. Some we can consider them fruits and vegetables in a pill. There's some evidence that certain supplements can be helpful and for some things and not others. But I think we should remember some of the dangers in our supplement and safety. There's very low regulation and consistency among them, so quality is a concern. It definitely cannot replicate the benefits of our natural foods that we put in. And then we do have to remember that there can sometimes be interaction between different supplements or some of our medications and supplements and some of our diseases and supplements. And so really, approach any interest or desire in supplementations with your healthcare provider so that they can help that decision. So optimal health is not complicated. Again, we want to maximize what we need for our individual selves. We want to minimize what is harmful to ourselves. And then we want to prioritize the environment that we put ourselves in, particularly with our stress level. So with that, hopefully you've gleaned some information and knowledge on how and what things can help complement our immune system. And we want to make sure that we do it simply and safely. So with that, that concludes the presentation. I want to thank everyone for sharing your evening and afternoon with me. Hopefully you're eating dinner if you're on the East Coast. And I definitely want to give another huge thanks to Megan for helping me put this together. So with that, I am going to end my presentation and we're going to, I think, open up for some questions.
Yes, absolutely. Dr. Sanders, thank you so much. That was deeply insightful and informative, and I truly appreciate you presenting this info for me and our audience. That was really incredible. As Dr. Sanders said, we are now ready for the Q&A. If you have a question, you can ask it by using the Q&A button in the app, or ask it live by raising your hand using the raising hand button, or press *9 if you're on the phone, and I will call on you. We'll start off with use an attendee who says hi. Diagnosed 1997 RR. Now seem to be entering secondary progressive. I'm in my 70s and was taken off DMT, Copaxone, several years ago and was told DMT is not recommended for senior citizens, but still have not received a reason why. Would you please comment on why seniors are not recommended for DMTs? Thank you.
That is a great question. When I first started treating patients with multiple sclerosis, I was telling my patients, this is your disease modifying therapy. You're on it for your entire life, and we'll just kind of go from there. But as our knowledge has evolved, as we've learned a little bit more about the immune system and the impact it has on multiple sclerosis, we know that as the rest of our body ages, so does our immune system. And so the data suggests that as a person gets older, their immune system becomes senescent. It becomes quiet. It is less likely to be active and less likely to cause relapses or MRI changes. So we see kind of a fairly steep decline in the risk for relapses over time. And so at a point, and there is not necessarily a specific age, but at a point, we have to start to begin to look at the risk benefit ratio or balance of our therapies. And so if we start to see that the potential risk outweigh the benefit that is waning, then there may be a choice to stop the medication. But in my practice, it's not necessarily a one-size-fit-all approach, and I have to take each person individually. So that there may be something that your healthcare provider felt about your profile that maybe made that risk benefit less desirable.
Okay, thank you so much. Got a couple comments from our audience. Catherine just wanted to thank you for your valuable information. And Tammy says, excellent info, relevant and presented in a clear and easy to understand way. So thank you guys for those really nice words. Peggy would like to know, is there a supplement or recommendation for nutrition that can help bolster low IgG levels that are impacted by MS treatments?
Unfortunately, there isn't. So your IgG levels are antibodies, and your antibodies are a direct effect of production by your B cells. And so they are, if you don't have B cells because you're on a B cell depleting medication, that result is a low or a decrease in your immunoglobulins. And unfortunately, there isn't anything natural or from a supplement standpoint that can build those back up.
Okay. Somebody wants to know, what effect do DMTs have on the absorption of vitamins and minerals, whether by food or supplementation?
At this point, I don't think there's really any data that tells us whether or not that they prevent absorption. But I do think it's important that we have to understand and look at potential drug to supplement interactions. And I know with certain disease modifying therapies, that we have to be mindful of that. And so it is important that you tell your healthcare provider all of the supplements that you are on, so that we can make sure that there isn't an interaction. We can check our little machine or program to make sure. But to answer your question, I don't think that there is any impact of our disease modifying therapy on the absorption or metabolism of our vitamins.
We have a question from Facebook. This is from Linda, and she is asking thoughts on LDN, immunomodulator.
Yeah, so low dose naltrexone has historically been compounded and available for the treatment of multiple sclerosis. I will say though that the data and the studies behind its utility in MS is still and remains very limited. But there are some patients that feel that they get symptomatic improvement or relief from the use of LDN. But it is not, there's no clear evidence that it actually truly has immunomodulatory effect.
Okay. Nicole asks, I'm on 50,000 IU vitamin D2 weekly and alternating with 100,000 IU every other week due to deficiency. Without it, my vitamin D levels go into the teens. I've been doing this for years. Is this not good for me?
So when you break down the 50,000 units over the course of a 7-day period, I do feel like you are still within your safety range of the medication. Obviously, your doctor should be monitoring your levels. I've talked a lot about supplements, but I think it's important to know that our body makes vitamin D. We absorb the UVB rays from the sun. And so that is another key way to increase your vitamin D without supplementation. But if your provider has put you on that regimen, I would assume that they are checking your levels to make sure they're not elevated. If you aren't familiar, the range for vitamin D in most labs is 30 to about 100. Generally, I like vitamin D levels around 50. I do get concerned when they get to the higher level, or definitely above 100, and dose adjustments will need to be made at that time. So if you're on vitamin D supplementation, your vitamin D level should be checked periodically.
Is there something you can do for high liver values from DMTs?
Nothing from a kind of a natural standpoint. Obviously, depending on the level of your liver enzymes, it may mean that you are not a candidate for that disease modifying therapy. And so it depends on the level, it depends on the medication, and it depends on if you're having any negative effects from that. So having that discussion again with your healthcare provider to kind of see where you are is good.
So I wanted to first say excellent presentation. Thank you. I was diagnosed with RRMS 15 months ago and started Alcavis in December of 2022. I had to talk to my neurologist into starting it. Do you have any suggestions for whether it might help me to search out an MS clinic for someone who specializes in MS for a second opinion?
Yes, I would direct you to the National MS Society website. They have a directory of all MS focused providers, whether it's physicians or physical therapists. And you can put in your zip code and it'll tell you who is within a certain mile radius from you. And that will kind of take you in the right direction.
Society. Karen from Facebook asks, what do you recommend for smoldering in?
We're still trying to figure out smoldering MS. And so for any of you who are unfamiliar with smoldering MS, it's really kind of a new understanding of what we were seeing as secondary progressive MS. And it's kind of a low-grade inflammation that's occurring in chronic lesions. So people are not necessarily accumulating new lesions, but their chronic lesions are still kind of festering, kind of like a fire that's dying. And so we haven't quite figured out the true treatment for smoldering MS. There is some evidence to suggest that high efficacy medications are helpful in maybe preventing smoldering MS. As I mentioned earlier, there is some optimism about BTK inhibitors that may have an impact on microglia, which could have an impact on smoldering MS. And then I think looping back to the lifestyle, the meditation, the exercising, the healthy eating, the anti-inflammatory approach can have some benefit of smoldering MS.
Okay. I'm going to transition this over to our audience member who has their hand up. I'm going to allow Robin to talk. Robin, would you like to say to Dr. Sanders? Robin? Robin, I'm so sorry, we cannot hear you.
Hello.
Oh, there we are. Oh, there we go. Hi, Robin.
Sorry. Sorry about that. I was diagnosed with MS in 2014, and so in March of 2014, so it's exactly 10 years. And I wanted to know if you could comment on why there aren't any changes in my MRI, but yet I see changes in my ability to walk.
That's a very common question that I get, and part of that kind of speaks to that smoldering MS. My theory or my understanding of really why is there a discrepancy between MRI and I'm getting worse is the one thing is that the MRI is correlates very highly with inflammatory activity, right? New immune attack to the nervous system. And so when we see that people are kind of slowly getting worse, secondary progressive MS, smoldering MS, that disease process is much different. And so we will see stable MRIs because you're not having relapses, but what you're having is what we now are thinking is smoldering MS, which we're still trying to figure out how to impact it. So the MRI is only one feature of the disease, and then two, it really correlates much more with relapses than it does with progression.
Thank you so much, Robin. I'm going to disable you're talking. Adelia asks, I'm on my 38th year of MS. I'm on Kalina. I have osteoarthritis and pain in my knees. Is pain in knees and legs common pain in MS?
So pain is very variable with multiple sclerosis. And I think it is important to highlight that pain does exist with MS. There is unfortunately not a particular type of pain that we can attribute to multiple sclerosis. And unfortunately, having MS does not prevent you from having other disease processes like osteoarthritis. And so sometimes it is very difficult to tease them out. But working with our orthopedic doctors or our rheumatologists that can look for other objective features of arthritis can be helpful to distinguish the two. But yes, pain can come from multiple sclerosis. It can also become because of secondary factors due to MS, not specifically the disease, but let's say you have weakness across your knee joint. And so the weakness subsequently results in into that joint pain. So there are a lot of different features, but kind of talking with your healthcare provider, engaging in the other specialists can help to treat you appropriately.
Okay, so I want to let our audience know, Dr. Sanders has been she's been very good with her time. She is going to be able to answer questions for just a few more minutes. So if I'm unable to get to your question, I'm very sorry, but I'm going to try to get these out as quick as I can. So Andrea asks, what are the side effects of too much vitamin D?
Yes. I think the biggest side effect that we have to be mindful of is kidney stones, but it can also contribute to weakness, confusion, frequent urination, constipation. So some of the symptoms that we commonly think of with MS, but I think the biggest one is kidney stones.
Okay. Shaniqua from Facebook asks, any thoughts about the I'm so sorry. Sabri infusion?
Is there a specific question about Sabri?
It was just a general question. What are your
Oh.
thoughts on the infusion itself, I guess?
So Sabri is really considered one of our high efficacy therapies when it comes to multiple sclerosis. It has been around for a very long time. We have to balance the benefits it has of reducing relapses with the risk for PML. So for those patients that are JC virus negative, in which the risk for PML is lower, it may be a good option to treat highly active disease.
This question comes up a lot in our presentations. Dana, first, I want to congratulate you on a great presentation, but she wanted to know, can you get a copy of these slides?
I will have to check with Megan, who's the original owner of most of the slides, before I can agree to share it.
Absolutely, fair enough. Someone would like to know, in your professional career, do you see a lot of physical progression even when MRIs are stable?
I do, particularly as patients go along in their disease journey. The longer you've had MS, the more likely we are to see a transition into secondary progressive MS. Also, age is a predictor of having disability progression, even when the MRIs are stable. And that might, again, go towards that smoldering MS. I talked about the low-grade inflammation that we can see pathologically or underneath the microscope. And on high field MRIs, unfortunately, in our regular practices in our normal care, we aren't able to have those tools to really truly see smoldering MS, but we have to assume that it is going on. And so it is unfortunately a fairly common thing that I see is stable MRIs with progression of the disease.
Okay. Dr. Sanders, we just have one last question for you.
Okay.
All right, this is from Tammy, and she says, can you comment on hearing loss with MS? Any connection with Meniere's?
Meniere's, yeah.
Meniere's is, she even wrote in there, probably spelled it.
Yeah. Hearing loss is less common symptom of multiple sclerosis, but there are areas in the brain, particularly in the temporal lobe, that help with processing of what we hear. We also know that as the nerves leave from the inner ear and insert into the brainstem, there can be lesions there that can impact hearing. I don't think that there's any correlation, though, between multiple sclerosis and Meniere's disease. Meniere's disease is more of a structural problem with the inner ear and the amount of fluid that's there.
Okay. Dr. Sanders, thank you so much for being so generous with your time.
Yeah.
So we're gonna let the audience know that brings us to the end of this event. If you missed any part, it's been recorded and will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for more info. By participating in a short survey sent to you after this webinar, you'd help us learn the type of info most meaningful and helpful to you as the attendees of these conferences. If you'd like to support programs like this, consider donating at msfocus.org/donate. Be sure to check out our supporter savings program as well, where you can save more than you get. Join us next time on Tuesday, March 12th at 4:30 Eastern with Dr. Brad Willingham to discuss the importance of exercise and how it affects the immune system. Thank you once more to Dr. Sanders, our attendees, and our wonderful sponsors, Genentech, Sandoz, Beatrice, E&D Serono, and Sanofi. Have a wonderful night, everyone. Thank you so much for joining. It's been a real pleasure.
Thank you.